from the American Academy of Pediatrics.
It's that time again. Time for us to answer your questions on another Ask the Pediatrician episode.
I think vomiting is often, almost always worrying to parents because it's scary. Your child looks like an alien when they're spewing, liquid or other contents out of their mouth. And especially when it's coming out of the nose, parents freak out because of that. I tell them that's the path of least resistance. So if it's easier to come out the nose or at the nose than the mouth at the same time, that's what's going to happen.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. This week, I really mean that because the questions came from you. Let's get started. Today, I'm welcoming back Dr. Jennifer Shu. She is the medical editor of healthychildren.org and a practicing pediatrician at Children's Medical Group in Atlanta, Georgia. She is also a mom. Jennifer, welcome.
Thanks so much for having me again, Edith.
Yeah, we're so happy to have you. It's been a long winter, Jennifer. I don't have to tell you. And there's a lot of things that parents are wondering out there, starting with immunizations. So our first question is, how is the immunization schedule determined?
That's such a great question because I think sometimes we take these things for granted. But just to boil it down to the basics, the immunization schedule is determined by top disease specialists, doctors, pediatricians, public health experts who get together and decide what is the best, safest, most effective way to protect our children from these vaccine preventable diseases. And then the schedule is reviewed and approved by the AAP, the Centers for Disease Control and Prevention, and then also the American Academy of Family Physicians.
Yeah. Jennifer, and I'm sure you've gotten this question that we got in our email so many times in your practice. I certainly have. Why do kids need so many doses of vaccines?
So if you think about it, when we give vaccines, we're giving just a tiny, tiny particle of the bacteria or virus that we're trying to protect against. And we give that little particle a little bit at a time, and they can be spread out over, 2, 3, 4 doses, whatever the case may be, depending on that vaccine. And researchers find out how much children need, how often they need them, the amount of time they need to be spaced out to get that best immunity to protect kids from these diseases.
Right. So it's really about making sure that they have enough immunity because otherwise the point is kind of defeated, correct, Jennifer?
Yeah. And the thing is, it can sound like we're giving so many vaccines, but if you think way back to maybe when I was a child, there weren't so many diseases that we could protect against, but each vaccine was much higher in the amount of particles that were injected. So now that we know how to fine tune some of these, we use the bare minimum amount. So the amount of particles that children get now is so much less than even I got from a handful of vaccines when I was growing up.
Yeah, I love that context. And it's definitely something that we have to point out to families and will continue to point out to families for as long as we need to, right? Jennifer, shifting gears a little bit, we had a question that came in asking, how do you ease a child's separation anxiety?
Yes, this happens so often, Edith, like when you're dropping a kid off at childcare, for example, and they cling to you, they grab your legs, they cry, they make a big scene out of it. And then after you leave, you often hear from the teachers, the kid had a great day. They don't want to go home at the end of the day. And so you know that they're actually doing fine when they're there. It's just the dropping off or somehow the goodbye process that can be tough for some kids. So the best thing to do is to try to make that separation as quick and pleasant as possible. So be very positive, tell your child goodbye, say that you're going to come back soon, and then just, talk about, I'm going to come back after work, or I'm going to come back after you have lunch and snack, so that they actually have something kind of more relatable for them to expect when you'll be back. So just make sure you do keep your promise. I am coming back for you, of course, and just be consistent and try not to drag it out.
Yeah. Jennifer, on a prior Ask the Pediatrician episode, you said something that blew my mind and totally applies to us at home. Sometimes the crying starts to become a little bit part of the routine,
it's like a
right?
routine.
Like it's
exactly
just part of the routine. And the way that we've approached it, because once you said it, I was like, oh gosh, that's definitely happening, right? The way that we've approached it is to say, it's okay. You don't have to cry. If you need to cry, you can, right? But you don't have to cry. And Willie, my my 3-year-old has started to sort of be like, I'm not going to cry today. I don't really need to.
Yes, exactly. It's permission not to cry or permission to change that routine or habit that they've gotten so used to because they've forgotten how to do the drop off without the crying.
That's right.
So let's practice. Even if you're at home and you do a role play and say, let's practice how I'm going to drop you off and just say, look, you're not crying now. Isn't this great? Let's try that at school.
I love it. And aren't you proud of yourself? That's the other one that we're trying at home.
Yes. You did such a great job.
I love it. Now, Jennifer, we also had a question from a parent of a tiny little baby. Is swaddling safe?
So that's a great question. Swaddling can be safe in infants who aren't yet rolling. And so you would want to use some kind of a thin cloth if you're going to swaddle and make sure that it's not covering your baby's face or preventing them from being able to breathe comfortably. Once your baby starts rolling or showing signs that they want to roll, it's possible that baby could get tangled in a blanket that comes loose, or they could be in a position where their airway is blocked. And so if you're starting to see that, and that might happen as early as 2 months of age, we recommend to stop swaddling. And if your baby needs to be warmer, then try something like a wearable blanket or adjust the thermostat in your home so that baby can be comfortable, but not have the risk of suffocation or entanglement.
Yeah, so important to know those nuances, right? And Jennifer, another question that came in is, when should parents worry about a baby's vomiting?
I think vomiting is often, almost always worrying to parents because it's scary. Your child looks like an alien when they're spewing, liquid or other contents out of their mouth. And especially when it's coming out of the nose, parents freak out because of that. I tell them that's the path of least resistance. So if it's easier to come out the nose or at the nose than the mouth at the same time, that's what's going to happen. So the time to get worried, if your baby has a high fever, if they're lethargic, if they have blood or bile when they vomit, if they're dehydrated, if they are skipping more than a meal or two from vomiting, those things can be warning signs. If you see any other concerning symptoms along with the vomiting, such as they can't go to the bathroom, so no poop, that could mean a blockage. If they have a headache or seizures, anything like that, really super fussy, those are warning signs that it's just not maybe a simple stomach bug and you need to seek some help.
Yeah, and never wrong to call your pediatrician, right? If you're seeing vomiting that has one of these signs and you're not sure or something feels off, never wrong to call us. That's what we're here for.
That is exactly why we're here. And it's important to note that vomiting is different from that happy spitter who has reflux and, pukes 4 times a day. My son used to go through 4 outfits a day. We had to cover the couches. We covered everything, burp cloths everywhere because that they're fine because they're happy and it's not bothering them to spew out these contents. It's kind of like an effortless, there it goes again. Whereas vomiting seems to be more uncomfortable. It can have a little bit more force behind it. So just if your baby looks fine, they're probably fine. If your baby seems off from their baseline, then that might be a time to call us.
We also were in the happy spitter category, Jennifer. It wasn't that fun, but he was okay.
No, it's a laundry problem, not a medical problem.
That's right.
Right? It's a laundry problem.
I love it. Jennifer, another question that came in is about breast milk. How do you properly freeze and store expressed breast milk?
That's a great question, Edith. We have some really good charts on our healthychildren.org website, but just a few principles to keep in mind. Make sure you wash your hands and have all clean storage containers that you can label and have ready. It's really important to have your equipment ready to go before you get started. And then once you pump, you should store the milk in small batches, 2 to 4 ounces, because if you do too much, it's possible that you're going to end up wasting it later if your baby doesn't want it. So small batches, and then try to refrigerate or chill the breast milk right away. So if you're out and about, have it in a container with an ice pack, for example, until you can get to an actual refrigerator or freezer. Always best to store expressed breast milk in the back of the refrigerator or freezer because that's where it's going to be the coldest. And if you're not going to use it within the next 48 to 72 hours, instead of putting it in the refrigerator, just put it straight in the freezer if you can.
Yeah, perfect. And it's something you sort of have to really actively think about at first and then becomes a little bit of second nature as you keep going in your breastfeeding journey. So hopefully that was helpful. Jennifer, when should parents take their baby to the dentist?
So it's actually pretty straightforward, Edith. As soon as a baby has a tooth, that's a great time to think about taking them to the dentist. Most babies have the first tooth by their first birthday, but not all babies do. And in fact, the latest I've ever seen a baby with a first tooth was at 18 months, and they were still perfectly normal. But in general, just try to remember this easy rule of thumb. Go see your dentist by the time your baby has their first tooth or no later than their first birthday. Sometimes it can be difficult to find a dentist who can see your baby soon. So your pediatrician may be able to provide fluoride treatments. And this is what our practice does. Starting at a year, we will do fluoride treatments for our patients every 6 months until they get into their dental home. So that's one option. But I do see sometimes it can be challenging if there may be not enough dentists who see babies in their practices near you, or if you're waiting to get dental insurance, for example. So sometimes I'll see patients at the end of the year who are about to get new insurance at the beginning of the year. And I just encourage them to get their appointment as soon as possible after that.
We also do fluoride in our practices, and I think it's such a great practice, again, until kids can get into their dental home. So maybe something to ask, right? If you're having a hard time getting in to see the dentist, could potentially your pediatrician give you a quick fluoride treatment to get you through and keep your kids cavity free, right? Until you get in to see your dentist. Now, Jennifer, I'm looking at the next question and I'm smiling a little bit because we've all been there. How should parents help their child breathe at night when their nose is stuffy?
That's a great question. So the first thing I say is, if your baby is snorting or stuffy, but they're acting fine and they can sleep and eat fine, you actually don't need to intervene in any way. However, if they're having a hard time sleeping or eating, then that's when you might want to do something like put a few saline drops in the nostrils. You can use a suction bulb or other type of nose suction. There are some electric versions now that they're hospital grade and they can really suction out any mucus that gets stuck in there. Sometimes just using a humidifier can help liquefy things so babies can breathe more easily. And then finally, if the baby sneezes, they may end up clearing their nasal passages themselves. So if you have a baby who's fighting you trying to put the saline in or suction, if you leave that nose alone, sometimes it'll fix itself.
Yeah, most things fix themselves, right? Some things don't, of course, and we have to be aware and mindful. But a lot of things, and little kids fix themselves. I'm a big saline fan, I have to tell you, in our own home. But yeah, sometimes fighting it is just not worth it.
Right, exactly. Exactly.
Jennifer, this was such a rapid fire questions. We love having you. Thank you so much, Dr. Jennifer Shu, for joining us today. And thank you to all the listeners who sent questions to podcast@aap.org, podcast@aap.org. Keep them coming. And thank you so much for joining us today, Jennifer.
Thank you so much for having me again, Edith.
If you like the Healthy Children podcast at home, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega,
Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
and our theme music was composed by Doug Nagel. This episode wraps up our 4th season, but we'll be back soon with season 5. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.